So when I was in fellowship, we were told the common saying that when you hear hoofbeats, you should think about horses and not zebras. But as a pediatric rheumatologist, sometimes hoofbeats can actually come from zebras. So we have to be very careful when we sift through the multiple complaints that a child is having to very carefully analyze in a keeping our eyes at the bigger picture, but at the same time not missing the tiny details. That's the job of a rheumatologist, to put together all the pieces of the puzzle and then answer the question of why a joint is hurting, or why I'm having unexplained fevers, or why I have a rash.
Dr. Joshi and I are a great pairing. We see most patients together so that we both are managing the entire cohort of rheumatology patients, so that we both know the patients well. I'm able to do that nurse practitioner looking from the 30,000-foot elevation and complement having a physician too. So the model of care that we're developing with having the physician and nurse practitioner together are a distinct advantage. You get that very cellular level scientific background of the physician and all of that expertise that Dr. Joshi brings. So I continue to do a lot of the care coordination, coordinating with other specialists in the office, in their offices that need to be a part of the care, and making sure that all of the full circle of care that these patients usually need when they're complicated or have a systemic illness pulls it all together, and I'm able to do a lot of that coordination role in support of the work that Dr. Joshi's doing in his role as the primary physician of the program.
So while we are working with the very young patients, which could be newborns to toddlers to preschool, their ability to verbalize pain and describe their symptoms specifically is very limited. And that's why we have to rely upon the cues that parents give us, the pictures that the family might have taken, or in fact the subtle cues that we find on physical exam. For example, if a joint has arthritis and we push that joint all the way to the end range of motion, it causes pain, and that would cause the child to either tilt the joint or withdraw. So it could be as subtle as a cue that we find on exam. And again, going back to my point of the relevance of ultrasound, it becomes extremely useful in younger children, because if you have bedside ultrasound available, you can just put the probe on top of the joint and diagnose inflammation inside the joint on the spot.
As a team, Dr. Joshi and I, very good listeners and both big believers in not ignoring a parent's gut, being able to help parents sometimes look at things differently or find an answer that they might not otherwise have been considering for the issues going on with their child. It's also really important that it's look, listen, and feel. You've got to just watch when you walk in the room. What's the dynamic? Is that child immediately frightened of you? We try to be very friendly and approachable and non-threatening, and when we go in together, we have a dynamic such between us that often families are immediately at ease, and often by the end of the visit, sometimes even by the middle, we're hearing from people, you guys are so helpful, it's been such a pleasure to talk to you, you've listened so well. That's our goal, is to be hearing that by the end of that visit, that we have allowed that opportunity for them to feel completely heard. We both believe strongly in the Maya Angelou quote of people don't always remember what you said, but they always remember how you made them feel. And it's very important to us that we're listening and making people feel heard, and that they feel we're an important part of their journey, and that we take it seriously, and that it is an honor to be able to be there and help them through this journey. Oftentimes with kids, it's play and being able to play going through the exam, depending on how young they are. And we just adjust and roll whatever the age is. If it's an anxious, overachieving teenager, then we have to talk to them about what their college goals are, for example. And so that we just adjust to however we need to do for keeping your eye on that main goal of making sure that they're heard and cared for.